The Child and Adolescent Mental Health Service, also known as CAMHS, works with children and young people with emotional, behavioural and mental health problems. In recent years, more and more young people have needed to access CAMHS and the service has been under pressure. Because of this, the service is now going through a time of development. Healthwatch Hampshire decided to ask young people and professionals who work with them about their experiences of CAMHS.
Well, it started off with the police. They said, because I was getting into like a little bit of trouble, like antisocial behaviour, so they said like, oh, why don't you go get yourself tested and see if you've got ADHD and all this. So it started from there really, and then I got my Motivate worker, and then that's when it started, because Carl got me into CAMHS, and then it just went from there really.
So a couple of the young people that I have worked with one-to-one, I've actually referred to CAMHS, and it's been a bit of a mixed bag, to be honest.
A little bit hit and miss really, actually, because you'll send something in and you'll think, this is so obviously this needs picking up, and it never gets picked up, or it just gets bounced back. The other thing I find right now is that some people are quite nervous about putting referral in because they've had so many kind of knockbacks that it just seems pointless.
I was referred to CAMHS by my GP. Initially, CAMHS refused the referral, but they accepted when my GP added information and increased the level of concern. I had a few initial meetings and then the case was closed. I was referred again later and the process began again. I waited nearly 2 years for an assessment for Asperger's, and then the results came. They were very inaccurate and inconclusive.
So we currently have clear referral criteria, and we have 8 teams that are all applying that referral criteria. And I think sometimes it's difficult to get a very high level of consistency around that application. So we're going to be looking at moving to a single point of access, but we're also looking to see how we can include our voluntary sector partners within that, so that when we're looking at those referrals, we can think together and much more broadly about a young person's needs and which service it is that suits them. And that will be done in one place. Currently, any professional working with a young person can refer into us, but also a young person themselves can refer. And actually our self-referral is very, very low, so it's between 1% and 2% of our referrals that come in. And we think that some of that is because people don't know that they can refer or how to do that. So one of the things that we've been doing over the last probably 12 months is developing a self-referral app, which will have some information on there about how to manage some mental health difficulties, but also whereabouts to access services.
It takes them a year sometimes to get an initial appointment, and then they'll go on another year's waiting list to receive some more formal support. And I think for agencies like us, we're picking up a lot more now as an intermediate to kind of just cover that ground, which isn't always the best way, because sometimes they need something a bit more specific.
Must have been about a year and a half at least, because there was so much like stuff, there was so much like paperwork, oh you're gonna go there and not, and then like all this change and all the stuff they was doing, it must have got all mixed up. And because one minute they were saying that I can go there, and the next minute I didn't, and then the next minute they'd change my appointment, and then another minute they'd do it again, and then the next minute it just got to about a year and a half, and then at that point I was like, I can't bother, but I did do it.
Yeah, most of the young people I've worked with who have been referred are at the point where they feel suicidal or are experiencing mental health symptoms to the point where it is so disruptive. For example, they don't want to stay awake because they can't resist self-harming, but they don't want to sleep because their nightmares are so bad they can't sleep. So, you know, their lives are just completely disrupted by stuff, and they're on the verge of really serious harm, self-harm, or killing themselves. So when we put the referral in, it's always with a bit of bated breath, like, oh brilliant, this could really be the help, you know, excellent, it's gone in, and then that kind of tapers down as time goes by and stuff isn't picked up very quickly, or you sent a referral in, nothing's happened, and I've then had to recommend a parent take them to the GP for an emergency psychiatric evaluation, and then it's been shortcut and gone that way, or they've taken an overdose, ended up in hospital, and it's been shortcutted in that kind of way.
In one instance, I referred a young man and was told that he didn't meet the criteria. And then 6 months ago he started going through what used to be the statementing process, and he has now been put on the waiting list for CAMHS support, when actually I referred him a year previous to that as well. So by now he could have actually been being seen, and actually he's now just started being on the waiting list.
Because I just wanted to get it over and done with. I don't want to know what was wrong with me. Because at that point I couldn't control my anger for nothing. It was terrible. It was just bursting out everywhere.
It's not acceptable for young people to be waiting as long as they're currently waiting. So we're going to be doing a lot of work over the next 6 months to look at who's on our waiting list and how we can best support move them forward and their mental health difficulties. And we haven't been able to keep people up to date about what's been happening. And some of that is because there's more demand than there is capacity. Getting in touch with somebody and saying, yes, you're still waiting, probably isn't very helpful. We're really hoping that we can actually get in touch with families and be saying, what kind of support is it that you need now, and think about how we can tailor the support that they need. But we're also thinking about how we can help other people to understand mental health and understand how they can support a young person who might be having problems at the point. So we are looking at how we can outreach some of our speciality. Our speciality is understanding mental health and how that manifests in young people. We don't have to do all the intervention around that. Other people will see young people on a daily basis. Having a teacher who understands your anxiety and what supports it and what makes it worse is going to be absolutely vital for a young person in terms of managing school.
The service that they offer is invaluable, but it's just the access to it is really hard to get to. And from experience and colleagues' experience, I think the general feedback is quite good. But it's just getting to that point most of the time.
Okay, normally they go in for an assessment and they'll often be referred to one of the, I don't know if they're dispensing psychiatrists or whoever can do their medication. So they'll be given whatever medication it is, which doesn't often seem to be very highly supervised in lots of ways, that they're kind of left to get on with it for a bit. And hopefully they'll get some form of therapeutic intervention. So they'll go and see a CAMHS therapist, but that can take an awful lot longer.
Well, it has helped me understand my behaviour and understand like how I work and like the way I think and the way to calm down myself and like techniques to like. But the medication they gave me, I didn't agree with. Like, it was making me feel down, depressed, all that, and like sitting in that room was terrible. I didn't like it.
Dealing with CAMHS was a very negative experience for both my mum and me. It seemed there were a lot of judgments without the correct facts being known. Following the assessment process, communication was bad. The person who did my assessment left, and then there was a further wait before any beneficial support could be offered. Once I began seeing a clinical psychologist, it felt too late, and the level of work being done was aimed at a much younger child than myself, which made me feel frustrated and I didn't want to continue.
What I'm trying to say is I think once people get into CAMHS, it's not always plain sailing. And then I've seen people labelled as non-attenders, and the service has kind of been withdrawn or is kind of tapered off or seemed to disappear, when actually they haven't non-attended at all. They may have not been able to do it once, but chaotic young people from chaotic families, the idea that they're going to be able to turn up on the doorstep the way, you know, a very kind of well-educated middle-class family, all of whom drive and the rest of it, it just isn't, it's just not a reasonable assumption. And then, yes, people being labelled non-attenders too quickly. But when they have seen the CAMHS therapist, generally they've liked them and they found them helpful. It's just being able to stay engaged with the service has been a problem.
It was just annoying, really, like getting all the way up there, because I live in Gosport and that's in Fareham, isn't it? So I had to get all the way up there just to speak to someone and then just to leave again, basically. And at that point, my mum didn't have a car either, so like, couldn't exactly like. We had to find out like, way of transport and all that stuff. So
Overall, both my mum and I found the experience useless, and we didn't receive any help that was required at the time.
I think halfway through they changed my doctor, so the doctor didn't have no clue like what I was like and like what was going on with me. They just knew by the paper. They just saw it by the paperwork and just said, look, all this.
We need to be thinking about what a young person needs when they come into our service. So we're very clear with young people about what it is they want, what it is we think that we can offer, and when we're going to know that we've done it. in order to offer a good level of quality, we can't just be thinking about the diagnosis or the difficulty that young people come with. We need to understand how that actually impacts on their functioning and what it is that they're doing. So having clear set goals with a young person enables us to tailor a service to them, and also enables them to be much more part of what they're doing when they come, so that the service can really think about how you involve a young person in their care, rather than professionals deciding what's the right and best way forward for them. So we're working really hard. We've got the ACE project set up, which is recruiting young people who've been through our services to help us specifically around service design and thinking about feedback. So if we know that young people want to access something within our service and didn't feel they were able to access that, having that information will enable us to work differently with the young person who comes through, but will also enable us to think about what kind of questions we need to ask somebody. Some young people are able to say very clearly, I want to do this or I want to do that, and this is how it's going to support me. Some young people are not as able to do that. We need to take some responsibility as professionals to think about how do we ask somebody about what's the room like, what's it like waiting, did you feel that you really had some choices about the way that the work went with you, did you think we should do something differently? So I think in terms of the future of CAMHS services, our aim is absolutely that young people don't have an unacceptable wait, that they're seen within a timely fashion, that their needs are understood on an individual basis, and that we're using the best kind of interventions that we can use for young people with the knowledge that we have. So a quality service, but also a timely service is absolutely our aim for the future. I talked before about working with our voluntary sector colleagues and working with other services that are available. I think we need to do more of that, and we're looking at how we can tailor our services to do that.
No, I would say when I first started, so this is coming up to 3 years ago, the young people we worked with were around risk of exclusion from school and a lot more around behaviour, and then over that 3 years I've seen it really develop into something that is a lot more, we still obviously cover that, but has then extended to the emotional side and that well-being, kind of self-esteem, confidence, and picking up, because there is no one really specific that does that drop-down service from CAMHS. That it's kind of like, I find schools in particular are trying to find any agency they can that can just cover little bits, because there's so many young people that are in need of some kind of support, but it isn't quite the same as having that real professional mental health support.
The links are very, very strong in terms of youth workers and youth work, particularly long-term local youth work being one of the most effective and essential preventative services. When you spend a lot of time with young people and you see them week after week after week, you're playing pool with them, you're having a cup of tea with them, you're talking to them about something, you're able to understand what their baseline is, and you're able to discern what is a mental health or emotional health issue rather than just the changes of adolescence. Sometimes they're just heightened symptoms of adolescence, but other times you're like, actually, that's not quite right for them. So you're able to understand and head things off very quickly.
And we found, Bridgemary in particular has been an area that had a real lack of youth services. So when we opened here, within about 6 months to a year, we were getting young people coming in and just like spilling everything at us. And actually it's really hard to deal with, like I say, when you've got 20 to 30 young people. And I think that is probably the best example I can give, that these young people they would then potentially have no one else that they could go to, and actually they might not need to go quite as high as CAMHS, but then they'll always have to be referred to CAMHS because there isn't anyone else that can do that in the interim, or kind of identify maybe that they have a lesser need.
I would recommend that they give more practical help, but in a suitable time period, not taking ages like they did for me. They should have listened to my mum more. They shouldn't have expected me to take time off school as questions were raised among my peers. My mum couldn't always get the time off work and it was inconvenient for her. They should have listened to the fact I was extremely uncomfortable talking in the best of the situations, and this was a distressing and upsetting thing to do. They could have offered alternative approaches or options to deal with it in a different way. For example, I love art, so something along those lines would have been included to make the process easier. My mum was made to feel as there was a stigma attached to bringing me, especially with her being a social worker.